Welcome to our Education for Providers presentation. Today we will cover the topics of eligibility and benefits and claim submission. Disclaimer. This information release is the property of Blue Cross Blue Shield of North Dakota Medicaid Expansion. This information is provided as is without the expressed or implied warranty. While all information in this document is believed to be correct at the time of writing, this document is for educational purposes only and does not purport to provide legal advice. All models and methodologies and guidelines are undergoing continuous improvements and modifications by Blue Cross Blue Shield of North Dakota Medicaid Expansion. The most current edition of this information contained in this release can be found on the Blue Cross Blue Shield of North Dakota Medicaid Expansion provider website at www.bcbsnd.com/providers. All rights are reserved. The North Dakota Department of Human Services, NDDHS, determines eligibility for the North Dakota Medicaid Expansion Program and provides the required information to Blue Cross Blue Shield of North Dakota. A member will lose eligibility and coverage for the Medicaid Expansion Program when one of the following incidents occurs. The member ceases to be a resident of North Dakota or moves outside of the state of North Dakota. The member ceases to satisfy any eligibility requirements for the North Dakota Medicaid Expansion Program. The member is enrolled in or covered by Medicare, North Dakota's traditional Medicaid program, or any other state Medicaid program, or if the member dies. The benefit plan does not cover newborns or dependents. Members who become pregnant may change to the traditional North Dakota Medicaid program at any given time. Verifying eligibility and benefits can be done one of three ways. First of all, you can use the Availity Provider portal, and in the Payer drop-down box, make sure you are selecting BCBSND. You can also call the number on the back of the member's insurance card or call the North Dakota Department of Human Services at 701-328-2321. Listed on this slide is an example of the North Dakota Medicaid Expansion Member's ID card. Here are a few tips to help you determine that this is a North Dakota Medicaid member. First of all, the alpha prefix will begin with the prefix of YME. The card will also identify in the upper right-hand corner that this is a North Dakota Medicaid Expansion plan. Also listed on the card is the member's primary care provider, also known as the PCP. All members are required to choose a primary care provider at the time of enrollment. If the member does not choose a primary care provider or the PCP, the state will choose one for them. Also listed on the back of the card provides member and provider service number along with the claim submission address. Additional benefits. Enroll to become a 1915I provider. The North Dakota Medicaid 1915 State Plan Amendment allows North Dakota Medicaid to pay for additional home and community-based services to support individuals with behavioral health conditions. Blue Cross Blue Shield of North Dakota partners with North Dakota Medicaid to administer claims for the Medicaid expansion members for these services. Coverage and payments are based on benefit plan and eligibility. Providers should complete the following steps in addition to other requirements set by the state of North Dakota for this program. Number 1, enroll as a 1915I provider with the state of North Dakota. Number 2, register for the Availity Provider portal. And number 3, submit a pre-certification on behalf of the member through the Availity Provider portal. Now let's take a look into transportation, meals, and lodging services for the North Dakota Medicaid Expansion Program. All non-emergency transportation, meals, and lodging must be approved from Blue Cross Blue Shield of North Dakota. Prior approval is required, and in order to do that, members should contact Member Services at 833-777-5779. This applies to in-network services only, and a member is required to provide a 2 business day in advance of scheduled appointment. This also includes that the member must be away from home overnight in order to qualify for this service. Pharmacy benefits are administered separately for the North Dakota Medicaid Expansion Program. Separate ID cards for prescription coverage benefits will be provided to the member. Benefits are administered through the North Dakota Medicaid Expansion Program. Prescription drugs are covered when prescribed by an enrolled prescriber using a tamper-resistant prescription pad or dispensed by an enrolled North Dakota Medicaid provider. 340B drug pricing program for providers may not use drugs purchased under the 340B drug pricing program enacted by the Veterans Health Care Act of 1992, Public Law 102 through 585. Codified in the section of 340B of the Public Health Service Act to provide any prescription drug to these members. Should the provider use the 340B product, services must be submitted with the UD modifier and include the appropriate national drug code. Now let's take a look at vaccines administered by a pharmacist. Pharmacists who have received the required training and credentialed and participate with North Dakota Blue Cross Blue Shield are authorized to administer vaccinations to members as appropriate. Proof of a valid North Dakota pharmacist license, pharmacist NPI, and certificate of immunization training is required to become a credentialed and participating provider with Blue Cross Blue Shield of North Dakota. Pharmacist administered vaccinations must be submitted as medical claims using the pharmacist's individual NPI number as the rendering provider and the pharmacy's NPI number as the billing provider. Claims received within the pharmacy NPI listed as a rendering provider will be rejected. Now it's time to review our claim submission process. North Dakota Medicaid expansion claims are required to be submitted electronically. If you are a provider who uses a clearinghouse or vendor already, you're well on your way. But if you're not and need an option, we offer the Availity Provider Portal. Since we'll refer to the Availity Provider Portal throughout this presentation, I wanted to take a couple minutes and talk about it first. If you haven't signed up for an account already, I strongly encourage you to add this to the top of your to-do list. Availity offers a user ID and password requirement, which is compliant with HIPAA regulations and is at no cost for providers. Availity also offers a secure online access to multiple payers. This also will allow you to submit claims easily, along with verification and submit electronic and benefit inquiries. You can submit claims and review statuses. You can correct claims, request a referral, request a pre-certification, review a remittance advice, along with other administrative tasks. You're also able to update the electronic funds transfer forms. If you have problems or need help, please contact Availity at 1-800-282-4548. Claim submission. Claims must be submitted electronically from the Availity Provider Portal or from your contracted provider clearinghouse or vendor within 6 months of the original date of service. Paper claims will not be accepted. For claim submission, as I mentioned, you may use the Availability Provider Portal or the Provider Clearinghouse or vendor under Payer ID 55891, which is the same as the Blue Cross Blue Shield of North Dakota commercial side. Also keep in mind that a separate remittance advice will not be provided for the North Dakota Medicaid Expansion Member. And once again, paper claims will be returned. For claims questions, we simply ask that you reach out to the North Dakota Medicaid Expansion Provider Services at 1-833-777-5779 for your questions. You may also review claim submission and claim status through the Availability Provider Portal. Now let's take a look at those claim submission timeframes. All professional 837P and institutional 837I claims must be filed electronically to the Blue Cross Blue Shield of North Dakota Payer ID 55891 within the following timeframes. 180 calendar days from the date of service for the Medicaid expansion only claims, 180 days from an enrollee retroactive coverage notification, and 365 days from the date of service for a claim involving a third-party liability. Keep in mind it is important to submit with the frequency type 1 under your initial claim. Claims submitted outside the timeframes will be denied unless the North Dakota Department of Human Services or Blue Cross Blue Shield of North Dakota or its contractors created the error. Claim corrections for the North Dakota Medicaid Expansion Plan follow the same process as the commercial side, which will allow a provider to submit a replacement or void cancellation claim through Availity. Claims submitted outside the 90-day time frame will be denied. The 90-day time frame is allowable time frame from the original date of service, but excludes Medicare, coordination of benefits, workers' compensation, no fault, subrogation, or third-party payers. Now let's take a look at a claim correction on the professional side. First of all, a frequency 7, which is a replacement of a prior claim. This can be used to correct data reported incorrectly from the original frequency 1 claim. So for example, this would allow you to change a diagnostic code, date of service, change or add or remove a line of coverage. An original claim number is required. You can also provide a frequency 8 or void cancellation of a prior claim, which is used to void a claim that was billed in error. So an example, claim billed with an incorrect billing provider. Once again, that original claim number is required. If the claim has been voided and the services still need to be billed, a new claim, frequency 1, should be submitted. Now let's take a look at a claim correction on the institutional side. First of all, the XX7 is a replacement of a prior claim. It's used to correct the data reported incorrectly on an original claim. So once again, that same example, this allows you to change a diagnostic code, data service, change or add to or remove a line of service, and it is important that you are documenting the original claim number, which is required. This also allows you to void a claim with an XX8, which is the cancellation of a prior original claim number, which is required when submitting adjustment bill type 7, XX7, and XX8 on all claims and 837I batch and real-time submissions. The void will allow you to make a correction to a billed-in error claim. An example is the claim was billed with an incorrect billing provider. Once again, that original claim number is required. If the claim has been voided and the services still need to be billed, you will submit a new claim number. Thank you for your attendance, and we look forward to working with you again in the future.